Thank you very much, Dario, for joining Energy Live News. It is obvious that we are all trying to find the pieces in the puzzle of understanding more the COVID-19 pandemic. And scientists from all around the world, they are trying to find, more insights about the understanding of the global pandemic. Among them, you have researched and you have finished and you have published a recent study about the possible and the potential correlation between the air pollution in some specific regions in northern Italy with the coronavirus. Can you tell us a little bit more about this study, a few more details about when it started, what did it make you to to start this survey, and why you needed to focus more in this specific area?
Yes, thank you for the invitation. So we actually we start from the simple correlation between the area in which lethality was highest in Italy, and it was in Lombardia and Emilia-Romagna, and the correlation with the highest level of pollution in Italy, which is of course that area, but it's also one of the most polluted area in Europe. So we observed that the lethality, the higher, that the level of lethality in this area was super high, especially compared with other Italian regions, but also compared with other countries. So consider that when we wrote the paper, because now probably the numbers are slightly changed, but we can say that when we wrote the paper, that the percentage of lethality in these two regions was around 12%. Instead, in the rest of the Italy was around 4.2%. We already knew that that area was super polluted compared with the rest of the Italy. We wonder if there was a correlation between these two aspects. And at the beginning, I asked for medical collaboration. So I collaborate with Edoardo Conticini at the University of Siena, and we established actually a correlation. Indeed, we observed that the inflammation of cytokine, which is the cause of the lethality, let's say, in people living in a polluted area like Lombardia and Emilia-Romagna, is also very high in also in a healthy patient, also in healthy people. Looking at that, we know very well that the inflammatory of cytokine is the first step to die from coronavirus, unfortunately. So we can say that for people living in this area, that's the first step is already done, let's say. So we have a higher probability to die in those areas. So that was the novelty of the paper.
Have you estimated with this survey which point of the particular matter level should be in this specific area in order to have and to see a lower level of deaths as well?
No, we didn't do that, because
Okay.
when you so for, considering the data from pollution, we based on the NASA satellite in Italy. You can have an estimation of the air pollution concentration in let's say in a very large area, but so you cannot have the information for punctual position of the map, but you have, of course, an idea of the large area. It's what is happening where all the industries are, and that's an area full of industries. So no, it's not possible to see this difference in this moment. Yeah.
Can you say that these findings of your survey can be applied also in other major cities as well? Today, there was another survey that was published saying that if Manhattan had lowered its average particulate matter level by just a single unit over the past 20 years, the borough could most likely have seen 250 fewer COVID-19 deaths. So, do you think that in general, air pollution is a major cofactor for the mortality rate that probably a region or a city could see?
I mean, I think it's a factor. I'm not sure. We cannot be sure now if it's one of the most important factor, but for sure it's a factor. So if we compare, for example, Wuhan with Lombardia in Italy, we also observe there is a huge difference in the age of the people. So in Lombardia, population is definitely older than population in Wuhan. So we cannot measure how much every factor is playing a role, and how crucial is the role that these factors are playing. For sure, we in our paper we add one factor more, and it's the pollution. And I mean, like, happy that also other papers are confirming that. Also, there is a paper from Harvard University that is probably published yesterday. And yeah, then of course they focus on US, but also in US, New York area is one of the most polluted, and one of the area with the highest lethality. The same in Spain with Madrid. Of course, we cannot make some scenario analysis. You cannot do that because you have several factors. So it depends how much every factor is playing a role. For sure, I think it's in this moment it's very important to know as much as possible about the virus, because we don't know anything actually.
But from your analysis, you can say that specifically for the northern Italy and Lombardia, the air pollution is a very important factor for this mortality rate, right?
Uh, yes, for sure. We know it's a factor, and we know that area is polluted. So for sure, has been played a role. But at the same time, we also know that we have a very old, an average, we have a very old population. So that's another factor. So probably in that area, more than one factor has played a role. So
Regarding the medical part and the medical part of the air pollution that probably creates health problems to people and makes them more vulnerable probably to this COVID-19. What would you say? Do you have any more details to tell us about this part?
we can say that pollution somehow make your immune system weak, so weaker than before. So people living in this area are more prone to be killed from the virus. So so it's a bad story to tell, but it's I mean, like, it's a factor. So we already knew before that if you live in a polluted area, of course, your immune system is weaker than if you live in a. But it's the point is that here we have a correlation between the problem generated from the pollution and the problems that you should have to have an higher lethality in this specific virus. So that's the point. So that's the novelty of the paper. So we found this kind of correlation. So problems due to living in a polluted area, and problems connected with the lethality of coronavirus.